Hi, good afternoon. Thank you so much for joining our webinar. Today we are going to talk about the Bloomberg Fellows Program, which is a part of the Bloomberg American Health Initiative. We are very, very excited that you all have joined and are taking the time out to be with us today. I'm Shannon Jones. I'm the Communications Manager here for the Bloomberg American Health Initiative. And today we have some special guests that we're excited about. We have our Bloomberg Fellow, Eric Harkness, who's with the Tennessee Department of Health. Eric works as the Director of Strategic Initiatives. In addition to Eric, we're excited to have with us Dr. Morgan McDonald, who's the Deputy Commissioner for Population Health with the Tennessee Department of Health. And lastly, my colleague, Shane Bryan, who's our Partnership and Engagement Manager, is here. And Shane will actually lead us through the slides and tell you guys all about the Bloomberg Fellows Program. A few housekeeping notes before we get started. We welcome you guys to please utilize the Q&A, the chat pod. We'll have a Q&A session after the webinar concludes. Additionally, we have tech support that will be available. So if you have any questions, just reach out to our tech support and they can assist. This is an audio-only webinar, so please be sure to mute and disable your audio on your devices. In addition, this webinar will be recorded and a link will be shared and posted on our website. We'll also send it via the Eventbrite portal following this recording. And if you have any questions, again, we welcome you to type them in. We're excited. And Shane, I will turn it over to you.
All right, Shannon, thank you so very much. And hello, everyone. It is a pleasure to be with you all and connected on this beautiful Friday. Again, my name is Shane, and I am looking forward to sharing some additional information with you all on the Bloomberg American Health Initiative and what we have to offer through the Bloomberg Fellows Program. So here at the initiative, our goal is to improve the health of America. Back in 2015, we saw for the first time in many years the life expectancy here in the country decline. And in 2016, the School of Public Health here at Johns Hopkins celebrated its centennial. So Mr. Bloomberg, who's an alum of the school, wanted to make an impactful gift that would allow for a long-lasting impact. The thought leaders here at the school and at Bloomberg Philanthropies got together and eventually came up with what is now the Bloomberg American Health Initiative. And we are rooted in communities across the country. We are a national initiative that seeks to find collaborations and opportunities to work with communities, organizations, and individuals all throughout the country. So we do our work by focusing on 5 initiatives and through 3 approaches. So we're going to talk about those here on the webinar today, and we are so thankful to have our friends from the Tennessee Department of Health joining us, and they can tell you more about their experiences directly as a Bloomberg Fellow and collaborating organization. So the 5 focus areas that are a part of the initiative are addiction and overdose, adolescent health, obesity in the food systems, environmental challenges, and violence. All of our work at the initiative is focused on these 5 areas. Now we take a broad approach, however, to them. So as let's use environmental challenges as an example. So certainly we think about climate change, air quality, but also within the environment we think about how a community's built environment affects the community's health, meaning what does the access to public transportation look like? What is the walkability of that community? How can air quality in a classroom affect students' learning? And with violence, we certainly are thinking of gun violence, but also intimate partner violence, community-based violence. So across all 5 of these areas, we do take a broad approach to both what it is and how the information within the focus areas can overlap with one another, but also how your work in your community will fit into one of these areas. So we have our 5 focus areas, and we also have 3 cross-cutting themes. And these themes we keep to the forefront of all of the initiative, and they are equity, evidence, and policy. So when we think of equity, as a national initiative, we want to ensure that we are reaching out and have partnerships, collaborations, and awareness all throughout the country. We want to also ensure that the folks who are involved, either as fellows, our faculty, or organizations, are coming from a diversity of lived experiences. We want to provide opportunities for fellows who come through a number of different career backgrounds. We aren't necessarily looking to find the folks who knew from early on that they wanted to work in public health, but rather, how are the folks who are working on the ground in their communities impacting health? How can we support those folks through this program? And so we'll talk a little bit more about that in the next few slides. With evidence, we are looking at ensuring that data is informing our policies and our programs. And so how can we set up strong data management systems to collect that data, but also use that data to tell our stories? And in policy, we are certainly looking at policies at the national, the state, and the local levels, using that evidence and that data to inform the policies, but also recognizing that policies within organizations can have a great impact on how that team or those staff members work on health in that community. So those are the three themes of our work, and really are a part of all that we do here at the initiative. So as I mentioned, Mayor Bloomberg provided the gift to get the initiative started. It's going to allow for us to bring on 25 endowed professors across these 5 areas that are taking innovative approaches and looking for impact-based opportunities to work with fellows and organizations and communities. We're also supporting 50 Masters of Public Health students to be a part of the initiative in collaboration with their employers, and 10 DrPH students. Our approach is 3-pronged. So we have research, practice, and education. Now, with the research and practice components, I am always more than willing to talk to you and share more about that, but for the sake of time and engagement with you all today, we're going to jump right into education. So under the education prong is where our Bloomberg Fellows Program comes into play. And this is not your traditional scholarship program. We really are looking for folks who are working in and with community, folks who are on the ground and addressing community health in their respective areas. We are looking for folks who are concerned with and working towards impact-based problems, targeting folks who are in these 5 focus areas. So our fellowship program works with the individual student, who would be the fellow, the school where the initiative is housed here at Johns Hopkins University School of Public Health, and the organization. So that is the unique player in that we fully understand that we are building out a national network of practice of individuals and organizations across the country who are working and focusing on these various areas. And we want to ensure that your employers, the organizations, we call them collaborating organizations, are supportive and interested and going to be a player in improving the health of communities. So we fully will review and take that into consideration in the application process. One thing I have not mentioned yet is for our MPH fellows, we also provide a $10,000 stipend. So that funding is available to students to use how they wish. It can be used for transportation, it can be used for books, a new computer, we ask no questions. But for the MPH students, we do have that added support. We also want to ensure that our students are successful, and so we have supports that we have set aside and resources to ensure that if a student might need some additional tutoring or academic support, we can provide that, and it's going to be high quality. So we're going to pay that tutor to work with you regardless of how many hours it is. We recognize a lot of the folks who are interested in coming to us from this program have maybe been out of school for a little while, which is completely fine, and actually we're looking for you, but we want to make sure you're successful. So we're gonna be with you and support you along the way. Oops. And so Here's just a little bit of a snapshot of where we are coming to you from. We have currently 95 fellows. We just got our new cohort, our third cohort of fellows started in June. So we slowly built up. We brought on 50 MPH fellows this year and 8 DrPH. And something that I will talk about how the trajectory plays out, but a great majority of these folks are doing the program part-time and continuing to work full-time and live in the communities where you all are located. We currently have fellows across 31 states. We are located in, we have a fellow in the Mariana Islands, one of the territories, and we have 6 graduates who have completed the program so far. And along with the 31 states, we also have representation in DC too. The just examples you can see here are just a few of the fellows who are a part of the program. They're coming at us. They're coming to the fellows program through a variety of backgrounds. So we have Thaddeus, who's at the Hawaii Department of Health, Leah, who works with an advocacy organization in DC at Food and Water Watch. Ashley's down in Texas working with the American Heart Association. Matthew is one of our graduates who just finished along with Amanda. Matthew is at a community health center in the Bronx, and Amanda up at a grassroots community-based organization in Sitka, Alaska. So we really do want to find you all who are working in and with your community on these various areas. And here's a few folks who are doing just that. All right, so I know you all came here to listen to Eric, and so I'm excited to have Eric and Dr. McDonald with us from the Tennessee Department of Health, who will really be able to share with you more about their experiences. Eric as a fellow, and Dr. McDonald as a representative from the collaborating organization. So Eric, thank you so much for joining us, and I'm going to turn it over to you and Dr. McDonald.
All right. Well, thank you, Shane. Really appreciate the opportunity to share with everyone today. And it's a real privilege to get to share with everyone on the call. And best wishes to all of you in your pursuits. And we'll be happy to answer any questions you might have later. So quickly about me. So my job is as Director of Strategic Initiatives at the Tennessee Department of Health. This is actually a brand new office as of July, so we're building on the previous work that I led in the Office of Health Policy. And one of the big projects that we worked on there is leading an initiative to support local health coalitions and conducting community health assessments across the state. Trying to think about how that work and insight can influence and inform work going on at the state level. So my experience as a fellow has been exceptionally positive. I've really enjoyed the opportunity and certainly appreciated the investment that's been given in me to be able to learn and grow in a number of different ways. One of the best aspects of the fellowship really is the people engaging and interacting with other fellows, coming from a number of different backgrounds all across the country, and also the faculty at the Bloomberg School and then the Bloomberg Initiative staff. Everyone is really supportive. People bend over backwards to help you answer questions, and it's just a healthy environment to get to be a part of. Another real benefit is the direct application to my job. Somehow I wound up in my current role without any graduate education, and so this has been a tremendous opportunity to kind of learn the theory behind the practice and getting to cover territory and ground that I probably wouldn't have explored just on my own. So it's been a tremendous experience to get to be a fellow. In picking my focus area, which is addiction and overdose, it's no secret that Tennessee is one of the epicenters of the opioid epidemic. And so there's a lot of work and activity going on in our state to address opioid and substance use disorders. And so I've been increasingly involved in a number of various aspects of our state and department's response. One of the things I got to do last year was help staff our governor's Commission on Pain and Addiction Medicine Education, which came up with curricula for our medical training schools across the state to try to standardize ways of teaching about addiction and pain management. So the fellowship, it makes me a more effective team member in my organization, able to play a more substantive role in our response to the opioid epidemic. And another reason that I was interested in pursuing this area is that in the opioid epidemic, it's somewhat unique in the public health space in that there are so many different sectors who are coming to the table and affected by the epidemic, but also trying to respond to it. And so I'm very interested in trying to learn what are we doing in our response that we can translate to other areas of public health, maybe obesity, other issues that haven't quite gotten that same level of across-the-board interest and response. The specific benefits that I can tell you about as a fellow, number one, obviously the scholarship is amazing. Being able to go to school while working is an exceptional opportunity that I was very interested in and I'm very thankful for. I'm also learning a lot. Every class has been really good so far. I don't think I've had one class that I would say has been horrible. Some are always better than others, you know, but on the whole, it's been a really positive experience in the classroom. And the online learning style fits my busy lifestyle as a father and husband and as a worker in our department. And then, as I mentioned, covering a lot of new ground and engaging topics and learning things like epidemiology that just make me a more effective team member in my department. And then lastly, the opportunity to grow my network, both within the Bloomberg School, but also among fellows and their organizations. I've had a number of calls set up with other fellows who have connected me with people that they've been working with to try to learn and engage with people. And so the concentric circles of the network are continuing to expand. And that's another really amazing benefit from the fellowship. So I'd like to now turn it over to Dr. Morgan McDonald. She is the Deputy Commissioner for Population Health for the department. It's been a great opportunity to collaborate and work with her in our department the last couple of years as she brings tremendous leadership to population health into our department. So with that, I'll turn it over to Dr. McDonald to share a little bit about what it's like from the organizational, collaborating organization perspective.
Appreciate that, Eric, and appreciate the time for everybody on the phone and really learning about this opportunity. I'll say from our perspective as a department, this is a huge opportunity, and I think Eric is perfectly positioned, if you will, both in his career and in his position in the organization to really maximize the benefit from the program. He, as he's described, really has a role in strategic planning, but also in community-based and state-level response to a number of challenges in the public health sector. And where he's positioned in the organization gives him pretty frequent interaction, both with local health departments and regional health departments and across our central office staff in a number of different program areas. Likewise, he's engaged frequently with external stakeholders. And so I think he's got a great perspective that he brings to the program, as well as a great, really sphere of influence to be able to put the education that he's receiving into practice. And so I think he's kind of the ideal candidate, if you will, for this type of program. And I'll say we are, a year into this in his experience, and I think we've just begun to see some of the fruits of that on our end. We actually have been kind of picking his brain a little bit this week and thinking about, all right, how are we going to bring back some of these reading lists and some of the tools of the trade that he's picked up over the past year, and not just implement it in his practice, but also think about that knowledge dissemination from an organizational perspective, and how do we really make sure that we're capitalizing on that. So more to come from our perspective in that. But I think overall, it's very much been a win-win from our perspective, both for Eric and for the organization. And like I said, even though we're early in the process, we've very much have capitalized on the benefits of this for the department.
Thank you both, Dr. McDonald and Eric, for sharing. And I hope that it is helpful for you all logged in and participating to hear what it's been like from their point of view. And they'll be hanging with us. I just have a few more slides, I promise, to get through, and we will jump into hearing from you all and any questions. I will say, feel free. I know a few folks have started adding questions into the chat bar, and feel free to go ahead and you can all start adding your questions in there, and we will get to them here in just a moment. So again, thank you, Eric. Thank you, Dr. McDonald, for sharing with us all. Now, as Eric mentioned, he's doing the program part-time, so he's able to continue working at the Department of Health and maintaining his family commitments in Tennessee. We do have a full-time option for those who are interested in taking a leave of absence, if you will, and coming to Baltimore at the School of Public Health. Now, this full-time option is just for the MPH students. It is an 11-month experience that will, you can see here a little bit of the outline. Now, our terms are 8 weeks long, so it is a really fast-paced environment. You are in school full-time. You really don't have an opportunity to do any work really outside of the academics in this program, and you would start in June and graduate and finish up in May. Now, we do have some folks who do the full-time format, but I would say a great majority, I think, of the 50 who are in the MPH program, 55 of them are doing 45 of them are doing the part-time program. Sorry, my numbers, lots of numbers this day, right? So anyhow, so a great majority do the part-time program, and this really allows folks to take classes online and continue their life commitments in their communities. For the part-time program, it can be completed in 2 to 3 years. You still go through the terms, so 8 weeks long for the courses. We're seeing that a good majority of our students are doing, depending on what's happening in their life at that time, 1 to 3 courses per term during the part-time program. We also offer institutes. So in the winter and summer, 1 to 2 week long classes where students come to Baltimore and they can get a lot of credits in a very short amount of time. They can have that classroom experience, and it's something that we've seen our fellows greatly appreciate. And we have an absolutely fantastic group of folks here at the school who support online learning, and we have over 300 courses that are available. And so our online learning is incredibly engaging, and we seek to be inclusive in making sure folks have a positive learning environment for those who are doing the part-time program. And just to again push that we are looking for folks who maybe have been out of school for a while. So we have that support. We have the academics assistance. If you need help in an EPI course or whatever the course is, all we need to know is the name of the professor and when it's being taught, and we will find you someone who has taken that class with that professor and support them in making sure you have a good experience. So just keep that in mind. Now, I want to share just a couple more things with you about other ways that we support. So we have what's called an Applied Experience Award. This is funding that goes directly to fellows and their collaborating organizations on specific projects that they would like to work on. I feel like we all have those ideas in the back of our mind, and if we just had a little bit more support and funding, we could get them off the ground. So the Applied Experience Award is available to fellows. It's an opportunity to work with your organization and bring in faculty to support on a variety of projects. There's been assessment projects. There's been a project developing a PSA, data analysis assessment. So really a good variety of different opportunities, and it's something that you and your collaborating organization identify. We also are working with your employers, our collaborating organizations, on projects that they identify as a need and of interest of working with us on. So we've had and provided guidance on policy changes, assessing best practices, and supporting getting those best practices out across the network, obviously research opportunities, and something that we're really excited about is building out this national network of practice and connections with organizations, similar organizations across the country. So right now we're at 95. Next year we'll be bringing on 50 to 60 more organizations. So that is only going to continue to grow as an opportunity. We're continuously developing new courses that are directly relevant to the work that you're doing, and through the American Health professors that we're bringing on, we'll be able to have more courses that we really can partner with organizations and communities to inform what those courses look like. So that way we are best preparing you all to take your work further. We provide seminars that are in a variety of topics, from performance management, advocacy, program implementation, and others, that we provide opportunities for live engagement, either being in person here in Baltimore or online. This is open to all fellows and their collaborating organization teams. So it's another way to share in on the learning process. So I think a lot of you are probably here to learn how you can apply. I'm sure you are all very interested and qualified, and we would love to have you. So real quickly, the application process, everyone must apply into the program, the MPH program, or those of you who are interested in the DrPH would apply into the DrPH program. Focusing on the MPH program, you would apply online through the SOFIS website. All of that is available on the school's website, and you can see requirements that they have. I would strongly suggest folks go and review the MPH program application requirements. Don't let anything scare you from applying, but just be aware. And if you have any questions, you'll see our contact information in just a second. Always reach out if you have any questions about that, and we can also connect you to some of our great colleagues in the MPH office. Now, for the Fellows Program, we also have our requirements online, but it is a two-part application. So we are looking for information both from the student applicant and from the collaborating organizations. And as I mentioned earlier, we equally evaluate both of those parts. So we are it's an essay-based application. So we are looking to learn about you, learn why you're interested in the program. What has your work been in the past? How will this fellowship program be able to further the impact of your work? And similarly with the collaborating organizations, we want them to tell us a little bit about your work and their work in the various focus area, and how and why they'd be interested in joining this national network. Now, applications are going to become available August the 1st. So that'll be posted online. We will share that with you electronically via email, but we will make sure that you see and get that when it comes out on August 1st. Priority deadline for the Fellows Program is November the 1st. So strongly suggested, if you can, to get everything in by November 1. And with our final deadline is December the 1st to get all of the materials in for this particular program. All right, so a few key takeaways. All of our work here at the initiative is impact-based. We know that it is critical for us to not wait 5 years to do another research project and see what kind of programs we can come up with. We know that you all are on the ground doing this work now, and so we want to support you, and we want you to be able to further your impact, be it either through partnerships with each other, with faculty, or with us here at the initiative team. It is critical for us to ensure that we are giving tools and supporting fellows in furthering their work and using the lens of public health. I know a lot of you who are on this webinar today are coming to us from a variety of career fields, and public health is really a way to do work and to view problems and to find solutions. So we want to be able to support folks in all types of careers doing just that. And our Bloomberg Fellows truly play a vital role in making that change. We believe that we are supporting the future leaders of health and public health and communities. So we greatly appreciate folks' interests and are excited to be supporting and working with you all. We want you to stay connected to us. We have our information website We're very active on the Twitter sphere at American Health. Feel free to reach out and tag us and all that great stuff. And our newsletter, the American Health Dispatch, that's where we'll be making that announcement when the application is available. But there's lots of great information that comes out in the Dispatch. Be sure to go on and to our website and join us at the American Health Dispatch. We also have a podcast where we're traveling across the country to hear stories from what people are doing in their community to improve their community's health. And we have a YouTube channel that has some really interactive and great videos that dives into some of these areas, focus areas, if you will. So my name again is Shane. My email address is shane.bryan@jhu.edu. Feel free to send us any questions. Also, our colleague Faria Zaman is the fellowship officer, and she is a wonderful resource that can also answer questions that you might have. So feel free to email either of us and then our website there. So I think we have some questions. It seems like folks are excited to learn more. So Shannon, what do you got for us?
Yeah, okay. Well, I guess I'll start up at the top with John. His question is, I'm not sure that I qualify for the program. I'm a special education teacher focusing on emotional behavior disorder for high school students, and I have a master's degree in instructional technology. John, you absolutely qualify for the program. As it stands, we actually, one of our new fellows with this new cohort is with the Walter Carter Elementary and Middle School here in Baltimore City. So we welcome teachers. If you have any questions or reservations or are unsure if your organization will apply or if you actually qualify, feel free to reach out to us. Don't self-select yourselves out.
Yeah.
All right.
I see the next one from Michael asking about, so it looks like there's interest in working with the State Hospital Association as the collaborating organization rather than the full-time employer. We do want the collaborating organization to be that full-time employer. So great question, Michael, and thank you for asking. If you have questions about what that might look like with your current employer, give us a call or shoot us an email rather, and we can certainly talk about that. But we are looking for the full-time employer to be the collaborating organizations.
Like we have a question from Gabriella. Can the DrPH be done online? Shane spoke to that, and yes, it can be done. The program offers a lot of flexibility there for MPH and DrPH.
Yeah, and just a real quick note, the DrPH is 100% part-time, so a good majority of that time can be done online. The next one, it looks like, would a school administrator or supervisor fit adolescent health approach? Absolutely. If you are working with young people, you are going to fit into the adolescent health approach. And just to really quickly, you notice that adolescent health is the only population-based focus area that we have, and that is because that is a critical time in someone's life where we believe that that's where a lot of folks will fall off, and with additional support and with a greater focus in that area, we know that we need to look more at the adolescents. So yes, a school administrator, supervisors, yes, absolutely. More information on the DrPH Fellows, the fellowship. So if you have questions, specific questions, let us know via email. We do focus on the MPH offering because we have 50 of them, and we want to make sure we get the information out there. Generally speaking, the application is the same for the DrPH MPH fellowship. The school application process is much different for those two. So if you have questions about the school application process, it's good that we can connect you to the DrPH office, and they also have webinars to talk about their process. But the fellowship part of it, from our end, it is very similar and nearly the same for our fellows.
Mm-hmm. And thank you, Shane. And also, Ashley, if you've had time to go on our website under the fellowship tab, there are two sections. One is designated for MPH applicants, and the other is for DrPH. It has a lot of information about the DrPH fellowship program, also an FAQ as well as a resource.
All right, so Michael, it looks like preference for broad impact versus deep and specific impact within one county. We're looking for a variety, to be honest with you. We have folks who are working on with national organizations looking at trends across communities, and we have folks that are working in a very specific community on a very specific issue. So we don't necessarily, I wouldn't say, have a preference for one over the other. Let's see. So can you please discuss that? I think we talked about the application process. So if there's any questions, please let us know. I am not able to see the slides. Hopefully we were able.
That was a tech question.
All right. Hopefully we were able to support
Thanks,
you.
tech support for handling that.
All right. To the timeline. Can you speak to the timelines? DrPH. I'm assuming they differ. The DrPH program is a much longer program, so you have, I believe, up to 7 years to complete that. Yeah, so it is a longer time frame there, and there's a lot more into the DrPH program. So if you missed the first bit, Morgan, we are going to provide a recording. Absolutely. We'll see that in the email. So Veronica, great question about GRE scores. So it is highly recommended to take and submit your GRE scores for the program. If you have questions about the GRE or your scores, that is going to go directly to the department, so the MPH office. They can talk to you more about that. Again, Shannon mentioned don't self-select out, but if you have questions, please, we can help you connect or reach directly out to the MPH office. Do courses taken during a previous MPH program count towards a DrPH program? So MPH is required, essentially. They highly recommend an MPH before taking the DrPH. So hopefully that answers your question there, but they won't necessarily take credits from an MPH into the DrPH program. Let's see, Brendan, hello, I'm excited. We're excited too. And workers, is it possible to speak with a faculty member? There's an area understanding health systems. Yes, so at 100%, faculty. If you're interested, we will connect you to faculty. We can connect you to current fellows as well. We have a series of webinars coming up specific to each of the focus areas, and we are doing our best to have faculty on those that can answer questions. But feel free to reach out. My email address is up there. We'll connect you to a faculty, and more than willing to have you help you connect and talk more. Head Starts, yes, 100%. So depending on what type of work you're doing at the Head Start, but if you have questions, please do let us know. Speak with a student if possible. Yep. Eric, I think would be happy to speak directly with you and others, Brendan, so just let us know. Let's see, if I already have a PhD. Let's see, so I already have a PhD and MPH. Is it still a good idea? Hey, you decide for you. Why not? And yeah, so PhD, MPH, DrPH, sure. Let's see, who else do we have here, Shannon?
Casey has a question.
Oh, Casey, thank you.
What is the dissertation process like for the DrPH degree?
Oh, great question. So all of our DrPH fellows and students will have an academic advisor who will coach them in that process and support them. You'll have a committee like you would otherwise, and we can certainly connect you with faculty that will, or rather the folks in the DrPH office, to help if you have specific questions of what that looks like.
Okay, and that's another question. Hi there, thank you for the overview. 2 questions. For the DrPH program, are there financial resources available to support travel and lodging for on-site institutes? And if there are additional courses locally that would provide more local context and local networking, is the program open to accepting credits from these local institutions, or must all coursework be completed at Hopkins?
Yeah, that's a good question. So for the first one, additional resources. So at this point in time, we don't have that set aside for that particular request at this time. But we would love to have you, and the fellows do come regularly to Baltimore to take those in-person courses. And for the local courses, I believe that all of the courses have to be taken here at Hopkins. So again, thank you for that question. More than happy to check into that one for you and see. But yeah, we have some various courses that they will take along their time here as a fellow. So we talked about the timeline. Fellows, do fellow applicants need to apply to both the MPH program and the fellows, or will an application to the fellow? Nope. So everyone, it's important that you apply to the MPH program. In parallel, you apply to the fellows program. So make sure you apply to both. Do we have opportunities for people that are registered dietitians? Ooh, I like that. And are any current fellows registered dietitians that I could connect with? Great question, and we absolutely would love to have and work and support folks who are registered dietitians. I am trying to go through all of our fellows that we work with. I know that a number of folks work in that realm, and we will look to see if we have any registered dietitians, but if not, we can certainly connect you to fellows who are in the obesity and food systems realm and see if there are ways or questions that they can answer for you. People that are registered, are we able to choose the organization we collaborate with? What is the criteria for collaborate? So you choose your collaborating organization by them being your employer, and we you would have to that would have to be a good fit. The criteria for a collaborating organization, we don't have a set criteria. Rather, we are looking for folks who are going to support you as a fellow and who are going to be a part of this national network. Organizations who are working in one or more of the 5 areas and that are making a positive impact in that community's health or the health that they are focusing on. So no specific criteria, also no specific requirements once you become a fellow. There's not like a weekly reporting form or anything. We are really looking to have a collaborative approach to doing this work. All right, where are we at, Shannon? What's another question?
The next question is from Mariah. Can you provide specifics around what the timeline after November 1st looks like?
Yeah, that's a good question. So I would actually say after folks apply, it is a very intensive review process. So that lasts many weeks. And there is a number of committees here internally at the school. And it's important for you all to know that the folks who are reviewing these applications are faculty. They are folks who are from community and are doing this work. So it's not just academics who are looking at your work. It really is people who are on the ground like you all and are working in the various areas. So, and then a number of staff, some folks from the initiative and Bloomberg Philanthropies all are involved in the review process. So it is a longer process. We hope and we work to get that out, those decisions out to fellows roughly by in the springtime, and so it does take, and we appreciate your patience in that, but we really go through and make sure we're getting and finding folks that are a good fit. All right, so I think that was all right. So we have to clarify, are we able to choose an organization okay, so hopefully the organization, the collaborating organization is your employer. So hopefully that is coming clear to folks. And if anyone has a question, reach out and let us know. Let's see, where could we speak about the DrPH program? We can reach out and we can speak more about that to you all specifically. Again, Shannon said that we have lots of great information online. So all right, where are we at there, Shannon? Is it Piper? You said that the range of classes taken by term, when is there an option to take a term off? What a good question. Thank you for asking that. And we certainly recognize that things happen, and particularly when you're working, you have a family, and you're going to school. We are flexible. So there is absolutely opportunities if you need to take a break or decrease your course load, and we are here to support you through that process. So yes, it is. And folks do take those breaks when needed. Period of time to before work. So there's not a required amount of time that you should have been working with the organization when you apply. Rather, we're looking to make sure it's a good fit both for you and the organization, and that they're going to be supportive and that you're committed to continuing working with them. After the fellowship year, after the fellowship academic component is completed, after you graduate, there is a 1-year service requirement. So you would go back if you're full-time and continue working with that organization for at least a year. And if you're part-time, once you graduate, continue working at least a year. Our hope at the initiative is that you will continue working many years with that organization, but at least 1 year is a requirement. And then you are free or open to move on, if you will. All right, Shannon, where are we? How are we doing here?
We're at Evelyn. Sorry I missed this. Is the MPH program accredited? And if so, could you provide more clarification?
Absolutely accredited. So good question. But we are, the Johns Hopkins University School of Public Health is the oldest school of public health in the country. We are accredited, and we are actually the #1 school of public health for, I think, the last 24 or 5 years. So thank you for asking that question. Let's see, where else? By economic and workforce development, not exactly one of the areas. However, senior national health emergency, this is opioids. So I mean, I'm reading really quickly, but it looks like you could I think you would fall within a focus area, and maybe it is the opioid and overdose focus area. Maybe it is adolescent health if you're doing workforce training for folks 14 to 26. Maybe it is environment if you're doing workforce development in the construction field. So I think we could talk more and see exactly where it fits best, and also I'd be interested in hearing how this could benefit you. So and one other quick note there. So we really want to hear from you all how it's connected. So I can certainly probably say yes, but the application process allows for you to also tell us why public health is a part of your work.
All right. The next question is in regards to the deadlines. 2 deadlines were provided for the fellowship application, November 1st and December 1st. I didn't quite catch if there's a difference between the two.
So the November 1st is the priority deadline. So we prefer that if we can get your applications in earlier, we'll be able to start processing them sooner. And it's always best to make sure that you aim for that November 1, so that way if there is any information that you need to get in, you have some time to complete your application process. We will continue to accept applications till December 1st, so please don't worry if you don't get it on November 1, but aim for November 1. Does the sequence of applications matter? Applying to the MPH and then the fellowship. I would say, JR from Minneapolis, that it is a parallel process, meaning that you can apply to both at the same time. You can actually go in now, though, and start working on your MPH application, because that is up. So you can start working on that and seeing all the different steps that are needed and getting your transcripts and your letters of rec and all of that. So you can go in now and start working on MPH, and then August 1, start working on the fellowship application. The hard deadline for both is December 1st. So good question, JR. If my work touches 2 or more areas, you can, okay, another really good, we get this a lot, Piper, so thanks for asking. So if you work, these focus areas are very intersectional. So if you're working in violence and adolescent health, as an example, you apply to one focus area, but the courses that you're taking are public health courses. Anyone can register and take these courses. So you will have opportunities to take classes in the other focus areas. You will have, let's say you go into violence as a focus area, you'll have a set number or set courses that you'll take, and that will be dictated, but you can certainly take other courses. So thank you. What is the acceptance rate? Joined late. Okay, so we're new, everyone, and so we are just building out our recruitment in ways that we can connect with folks. So at this point in time, we don't have an acceptance rate. We've built up the fellowship program over the last 3 years and are continuing to build it. So we don't necessarily have an acceptance rate that we can share with you at this point, but we look forward to your application. And sorry, I couldn't give you a better answer there. Let's see, where else? Currently have fellows from California, specifically people from California public health jurisdictions. We do, Evelyn, as a matter of fact, and more than happy to connect you with any of those folks if you are interested. We also have folks in California who are working with community-based organizations and national NGOs. Let's see. How long do you anticipate the fellowship program to be funded? For example, I'm doing wonderful. So the Mr. Bloomberg gave us a $300 million gift for this program. The fellowship program is funded through the interest on an endowment. So we foresee this going on for many years, and you'll have time to apply. So thank you for that question. All right, where are we at, Shannon?
Let's go down. Yes, the webinar will be recorded after we conclude. The next question: I work with an organization that primarily support government clients, and my work is emerging chemicals. Does my profile relevant for the DrPH environmental challenges?
Send an email and let's chat about that. I think that's a specific question. I'd love to talk to you more. Share more information about Hopkins admission rates. You should apply. If you're interested, you should definitely apply. Don't let those statistics scare you away. It's certainly important information, but you all are interested if you are on this webinar, and we want to see your application. And so, yeah, apply. Let's see. Shannon, do you have another good question? I know we're getting close to time.
Yeah.
So
let's see.
I
have a bachelor's degree from 20 years ago, and my undergraduate GPA wasn't the greatest. I've been doing work in the community since, and is very passionate about it. You definitely could still qualify, and Shane could speak more to that.
Yeah, so apply. We are looking for folks just like you. Is that coming from Christina? Christina, we're looking for you, and we're happy that you're on this webinar. And we know and recognize that we are looking for folks who have not taken traditional paths to public health. And so we have opportunities to advocate for your application and admissions into the school, and we will do just that. And we know that there are ways that we can work with and support you, and we want you to become a fellow. So please apply. Let us know if you have questions in the process, and we can certainly answer them for you.
Okay. Next, a good question from Ashley. You believe one of your colleagues is enrolled in the MPH program. Yay. Would the Bloomberg School permit 2 fellows? Absolutely. We currently have 2 fellows that are a part of Get Healthy Philly, which is an program under the Philadelphia Department of Health. We also have 3 fellows who are with the Chief of Police. So that is not an issue at all.
Yeah, and so I know there's lots of similar questions. So if we're not answering your question specifically, or you want more information, please reach out and let us know.
I see a question for Dr. McDonald. Are you guys still there, Eric and Dr. McDonald?
We are.
Okay. What was the draw that encouraged you to support Eric's work in applying to the fellowship, and how was it an incentive to you in thinking of how this person could present it to her company?
Well, to be honest, I wasn't involved from the very beginning. It was our prior commissioner. I am the lucky inheritance. I get the lucky inheritance here. And I think Eric may be able to speak a little bit more to kind of how we really developed an awareness of the opportunity.
So our previous commissioner, John Dreisner, was a colleague of Josh Sharfstein, who is the Bloomberg Initiative director. And Dr. Sharfstein at one point was the commissioner of the Maryland Department of Health. And so he and Dr. Dreisner had connected, and Dr. Dreisner became aware of this fellowship opportunity. And Dr. Dreisner continues to be a mentor of mine, and in that role as my supervisor at the time, really encouraged me to apply for this fellowship. And I think saw the vision for how, as a department, we could engage a much broader network of other innovative institutions and organizations that are grappling with these same challenges that we are in Tennessee. All 5 of these focus areas are ones that we as a department get to deal with in our role as a public health authority for the state of Tennessee. And so it's been, I think, a really good opportunity for us to engage the Bloomberg network on these various fronts.
Awesome. Thank you, guys. Thank you both for answering that question. I saw a question about clarification on the stipend. It's available to all MPH fellows, so part-time and full-time. There was also a question that I saw about interaction and connecting with faculty, particularly for those who might be doing it in the part-time program. So we here at the initiative provide opportunities through a number of ways of partnering and working with faculty. We have our American Health Summit, where we're bringing together all of our fellows, all the collaborating organizations and faculty annually. So that's a really good opportunity to connect and work with. We have financial support also to ensure that faculty, if there's a particular question or issue at your organization and you want faculty to come and work with you all on that, we have ways to support that. We have phone calls regularly and other learning opportunities that are just for fellows and faculty. So that's another way. And there's always opportunities to ask questions and to engage with faculty in these various online learning opportunities. Because we have a majority of our fellows online, we want to make sure that you have equal access and opportunities to connect, engage with, and make sure you're getting to know and hear from these faculty. So wonderful question, and thank you so much for asking.
I want to read Tasha's question. She works with the Association of American Medical Colleges as an executive assistant, and she's concerned if she does or does not qualify for the program. Tasha, we definitely recommend you to still apply. Please send an email if you have any reservations about, if you apply or if your organization applies. Feel free to send an email to Faria Zaman, whose contact information is listed on the slide. Faria can talk you through which focus area may be compatible with the work that you're doing. So don't rule yourself out. Just send us an email, and so that we could best figure out how to see where you fit in with our different focus areas.
Yeah, here I'm seeing their organization is very excited to be a collaborating organization. Any specific responsibilities, and what does it mean to participate in a national network? So the responsibilities is to support you as a fellow, and to work with fellows in ensuring that they have a rich experience applying their learning into practice. There's not specific requirements like reporting or working on a number of projects, nothing like that. To be a part of a national network really means willingness and interest in collaborating with communities and organizations across the country. So again, no really set in stone, this is what you have to do, but rather this is what we hope to support, sharing best practices. It could mean that there's a peer organization a few states away and you want to go there and learn how they're doing their work, and we want to support that. So those are some of the examples of what it means to be in a national network, and we are excited that your employer is interested and wants to be a collaborating organization. Feel free to, my main role actually at the initiative, I didn't even get to talk to you all about that, is to support collaborating organizations. So if they want to talk to us or speak more about what that means, I am more than happy to have that conversation. All right.
Okay.
Go ahead.
I'll take Nia's question. You mentioned briefly that the summer and winter institutes are 1 to 2 weeks long for DrPH, and do students get enough advance notice in order to take time off from work?
Yeah. Yeah, so those institutes are for all students, not just DrPH. So good question, and they are set. They are institutional wide, so they are those dates are set, and you can find them online. So you will know when they're taking place, and you'll have plenty of time to do the request off for work.
Okay, we will take a few more. I'm employed on a Bloomberg Philanthropies funded project. Would this be considered a conflict of interest to apply?
No. I don't think so. Good question though, and thanks. If you have any specific, or if your employer wants to chat more about that, that should not be a conflict. No, thank you for asking though.
Okay. Let's see, we'll take one more. I think we have time for one more. Shane, do you see one that?
Let's see. I think that there's lots of good questions, I would say, and I see a lot of questions from DrPH, probably because we didn't talk too much about the DrPH program, but just know if you have questions and we didn't answer your question or you want some more information, we can't stress it enough. We are here for you as you're considering this program, if it's a right fit for you or if your organization has questions. Faria, myself, Shannon, and our entire team at the Bloomberg American Health Initiative are here to support you. We greatly appreciate you all coming and spending some time with us today. Again, thank you so much, Eric. Thank you, Dr. McDonald, for being here and sharing your experience with all of our participants. And we look forward to seeing your applications and to reviewing the great work that you're doing. So Shannon, anything else?
Yeah, no, thank you guys for joining. Just echoing Shane's sentiments. We're very grateful that you all took some time out during your lunch hour to be with us today. Again, we're sorry if we couldn't get to all of the questions, but feel free to reach out. We will do our best to get those questions answered. And as a reminder, this webinar will be recorded and it will be shared following this recording.
All right, y'all have a wonderful weekend. Thank you so much.
Thank you so much.